Brian, thank you very much. Well, the CDC guidelines that were posted and then quickly taken down, obviously raising plenty of confusion and questions out there. And to help answer some of those questions, we welcome Dr. James Baker, professor of allergy immunology at the University of Michigan. Dr. Baker, welcome to News Nation. Thank you for taking a few minutes of your time tonight. We certainly appreciate it. And let's just begin with Brian's piece there, kind of explaining this latest issue with the CDC in terms of these findings. Can you just, as a medical professional, talk about where the current understanding is in terms of how this virus spreads and what are the best steps all of us in the general public can do to protect ourselves?
There's very good agreement that this is a respiratory virus. It's transmitted by respiratory droplets. And the most important thing you can do to protect yourself and others is to wear a mask. And most masks provide some type of protection. As alluded to in the article, clearly a surgical mask might be better in slowing down the droplets.
And in terms of this issue, the number, the figure 6 feet has kind of been just imprinted in all of our heads for months now. What do you think of that recommendation? Is 6 feet enough? Is it not? Or is the jury still out?
I think 6 feet is a good general recommendation, and most aerosols do not transfer longer than 6 feet, but in rare cases you can get larger transmission areas. And as alluded to again, if you have not much ventilation in the area, if you're in a closed room, if you don't have good air conditioning or airflow, you're more likely to get long-term transmission.
And that's such an important point. Tomorrow, the first day of fall, the weather's going to get cooler in many parts of the country. What are you concerned about as we enter the cooler months?
I think everyone's concerned that people are going to be more inside and more likely to spread the infection to each other. And that's why I think we need to be very vigilant as we move indoors to make sure that we wear masks and we take care of the social distance.
Are the masks as effective when you are indoors as they are when you're out, meaning if you're in a restaurant, at church, what have you, in a store, in the dead of winter versus outside in the middle of June? Are the masks effective regardless of environment and temperature?
The masks are actually more effective indoors because there's less chance for sunlight and air to disrupt the virus as compared to being indoors. If you don't have a mask on indoors, your pool of virus from your respiration sticks around. So in fact, it's more important to wear the mask indoors, and it will be effective.
And what would be your number one bit of advice to the public right now, heading into the colder months, and also in terms of the numbers as the pandemic stands here in the country, getting close to 200,000 dead and almost 7 million cases? What is the number one thing you want the public to understand to get through this?
I want them to understand that most people aren't at risk if they do the appropriate social distancing and wear a mask. And in fact, if we all do that, we can reduce the death rate and the infection rate tremendously as we wait for a vaccine.
And are you, last thing, in 10 seconds, are you optimistic we'll have that vaccine? What's your personal timeline?
I'm optimistic that we will have a vaccine. We have 170 of them in development. My guess is they'll probably be next spring before they're available. And then we can give them to the most vulnerable people and our first responders who need to protect themselves.
Dr. Baker, thank you so much for your time tonight. We certainly appreciate it.